Hello, friends. As you know, I'm getting experiences from around the world about how COVID has affected people around the globe. Today, I have Dr. Luciana Fanti. She is from Brazil. And thank you, Luciana, for agreeing to be on this video with me. It's good to see you again.
Yes.
So, Luciana, I'd like to, first of all, ask you how you are doing and how your family is doing.
Okay. So we're my small family. We're all doing okay. I have a husband and a 4-year-old kid, a boy, and we have this small cottage outside of the big city of Sao Paulo. So we're spending these days here because there's a little bit more space and we can be in the sun a little bit. So we're fine. And I also brought my mother with me. She's 72, and she had been isolated from everybody for almost a month. And we are, very attached to each other. My mother, myself, and my 3 sisters. But she was completely isolated. But just as of 6 days ago, my uncle, her brother, passed because of COVID. They were very close to each other. He was 74 and he was pretty healthy. He was still working as a business consultant. And after that, it was impossible to keep her on her own, because of the emotional burden. And so I said, we're going to be very careful, but now you have to stay with one of us. It's not human for you to stay alone in your apartment anymore. So, we are coping with everything at this time. Yeah, so we're living one day at a time.
Yeah, so sorry to hear about your uncle, and particularly devastating that he was a healthy individual that had no other reason other than this virus to really take his life. So I'm really sorry about that. So are you all confined in Brazil now, or is it by sections, or how is it happening now?
Yeah, what's happening is that Brazil has the states, and it's actually the local governors who have the policies to do whatever they want in the states. And if I'm not mistaken, in most of the states are now have policies for social distancing. It's not a complete lockdown, but it's social distancing. And my state in particular, which is the state of Sao Paulo, which is the richest and the most productive state of the country, has extended its social distancing period up to May 10th at this time. So it's been like, periods to periods, and we have now extended that a little bit. But I'm not sure about exactly the situation for all the other states. I think it varies.
We've heard about different areas of Brazil being affected in different ways. So, for example, of course, the more populated areas like Sao Paulo and Rio are more affected. Is there a big problem, for example, in the favelas? And also, I think I've heard reports of the Amazon. Can you sort of tell me a little bit about those areas in particular?
Yes, absolutely. So, the first case that was reported here was someone who had been in Italy, was a businessman. The first reported case actually, and for some time, all the cases were part of the upper and middle class, upper middle class and upper class, because these were people that were traveling abroad. So these were the ones who brought the disease, the virus here. Um, and then the profile is changing over time, right? It's going to the lower classes, and now it's actually reaching the favelas, the communities, which is a big problem because these people cannot really have social distancing, because these are crowded places, and especially in Sao Paulo and Rio, we have lots of favelas, and there's been deaths already. So it's transitioning a lot. And it's a big concern in the health, among the health professionals. And as you mentioned in the Amazon, what's happening, it's actually interesting why we have so many cases in the Amazon. And also I think at least one person that I'm aware of from an indigenous population died of COVID. The big problem, Nancy, is that this is not a wealthy state, the Amazon. So they are already, overwhelmed. They don't have enough facilities to treat these people. That is the biggest problem.
And what is the biggest challenge then that you're going to face, in particularly the areas of the favelas and the Amazon? Is there a plan to educate people to try to distance them, or?
Oh, that's what we've been hearing from politicians, that they will have dedicated efforts for those people. In the beginning, there was an attempt to take the most vulnerable people from the favelas to put them in hotels and things like that. And it was interesting also in Rio, because there are some very nice hotels, and these people did not want to leave their homes, their poor homes. They were like 60, 70, 80-year-old people, and they didn't want to leave their families. It was a cultural thing, so it didn't really work. I'm not familiar with what they're going to do now, but clearly it's going to transition a lot to those populations. The wealthy and the people that have more resources will be working from home. There's a lot of pressure right now to reopen the country. And these are the people that are going to suffer the most, because they have informal labor. They need to go out to make money, and they are being pressed to go back to work. And so we're afraid that these are going to be the most affected people now.
Yeah, I think every country is struggling with how to open up society again. I spoke to somebody in Germany earlier today, and they're doing it very, very carefully. Um, let me ask you one last question. We have been looking to countries below the equator, thinking that because you're going to enter your winter, you are now in your autumn or your fall, that perhaps the virus will behave in a different way. What are you hearing in terms of what can happen as you go into your winter?
What we've been hearing from the authorities is that, and someone actually referred to this as the perfect storm, because we're entering the time of H1N1 influenza, also dengue, which is very prevalent in some areas of Brazil, and now COVID. So they expect an increase in all these diseases. Yeah, some said this is, but I haven't actually heard a lot about this. Usually in the winter, we have more of respiratory diseases and viruses, and people are concerned about all the other viruses. One thing that was done by the government is that they anticipated the vaccination for influenza from the actual schedule. They did that before, they anticipated, so that diagnosis could be easier for COVID. Because we're actually now going up, right? All Brazil is going up in the rate of COVID, which coincides with the end of summer.
Yes. Well, Luciana, thank you so much. Muito obrigada. And I again, my condolences to you and your family for your uncle. And I'm going to ask you to please keep your family safe. And I hope to speak to you again, and that this is all over by the time we talk together again.
Yeah.
Yes.
Yeah. Thank you so much.
Muito obrigada. Ciao.
Ciao.